Welcome, everybody. We are Nancy and Dr. Dick Walker. We are filling in for the Redox 5 crew. They are on a little vacation tonight, and so we are here to talk about oral health. We have an expert with us, Dr. Duane Starr, and we're going to talk about everything about redox and how it influences our oral health. You don't often hear people talking about that, but believe it or not, we are excited about that. I'm a retired dental hygienist. Dr. Starr has a very busy dental practice in Oregon in the United States. So take it away.
Hi, I'm Dr. Dick Walker. Many of you know me, probably not all of you. But I was first introduced to Asea Redox 11 and a half, almost 12 years ago, and I knew nothing about redox at the time. And I was looking for another technology that I could use personally to improve my health. I was 64 going on 65. My body was starting to tell me that I couldn't do the kind of crazy things that I like to do, climb mountains, that sort of thing. And you know, I had accumulated some injuries that were slowing me down and hurting, and I was just looking for something out of the usual, pain pill, that sort of thing to manage it. And I started bumping into this whole idea of redox signaling, and then a friend of mine, a physical therapist, told me, "Hey, there's a company in Utah that makes a supplement based on that." I said, "No, I don't believe it, because nothing that I read anywhere said that you could supplement with these molecules because they were too unstable, the ones that are made in our body." But he said, "No, yeah, let's go down and look at it." So we flew down and met with the scientific team, and I came back. No, yeah, we did fly down. I paid the extra postage and shipped a case of Asea back so that I would have some right away. And both Nancy and I started taking it right then and there. And we had just incredible results with our health. And so I started branching out and recommending it to people who I knew who were not getting the kind of results with their health through a strictly Western medical approach. And it started working on most all of them. And so that got my attention enough that I decided to start the business of ASEA. And it'll be 12 years in October. But this is a wonderful technology. For those of you who don't know what it is, redox signaling molecules are made in every cell of your body. If they weren't, you wouldn't be alive, because they regulate much of your metabolism. And they are very important in turning on the repair mechanisms that our body uses to fix and repair things when they go awry, wounds or illness or whatever. If we didn't have redox signaling molecules natively in our body, we just wouldn't we couldn't maintain our health. And so being able to supplement with these molecules just sounded like a very good idea to me. And I want to point out that Asea Redox is marketed as a supplement, but it's not a nutritional supplement. It is a cell signaling supplement. What these molecules do is assist your body by supplying additional signaling molecules so that your body can very clearly turn on repair pathways that need to be turned on, detoxification pathways, and help to control what's called oxidative stress, which is the precursor to inflammation. And so through that pathway, they even can have an effect on slowing down the oxidative stress that leads to inflammation, that leads to aging. And so they are a very useful technology, a very useful tool for our body to use to improve the body's ability to repair and replace damaged cells. So Nancy, let's hear a little bit about, I forgot to
Yeah.
tell who I am.
So let me just say, you don't have to be a doctor or any kind of a medical professional to change the world by sharing ASEA Redox with everyone you know and love and everyone you meet. But we like to, since an interview webinar where we interview medical professionals. I want Dick to say his credentials, because we want you to realize that when we talk about when he talks about science information, and we just want you to know that he knows what he's talking about. So go ahead and tell him
Yeah,
your credentials.
I have, a doctoral degree in preventive medicine and environmental health. I also graduated from medical school with a MD or a medical degree, and I'm board certified in both emergency medicine and internal medicine. So when somebody asked me one time how many years I spent being educated, it was a lot. It was
I think 17 years,
or more,
right?
yeah. So, I do know what I'm talking about, and I've been interested for years in alternative ways to manage health because many people can't take drugs. They aren't candidates for surgery, and yet they have serious health issues that they're just really looking for an answer about. And that's really where redox technology comes to play.
So I'm Nancy Walker, and I didn't go to school as long as Dick did, but I am a retired dental hygienist, and I loved my profession. And I was a dental hygienist for about 22 years. I was in private practice, and I also had my own business where I would fill in for about 14 different offices when their hygienist called in sick, or if they had a hygienist who was taking maternity leave, I would go work in that office in addition to working at my main office. And then I also taught clinical skills at Eastern Washington University in the dental hygiene department. So I did lots of different things. When I was introduced to Asea Redox, our friend Jerry White, many of you know him, came to our house and told us about Asea Redox, cell signaling supplement, and he knew that I had health challenges for many, many years. So I would say about 35 years went by and I didn't feel that great. I didn't feel good. Okay. For 35 years, I slept a lot. I slept at least 10 hours a night, but I was never rested. Every time I sat down, I would fall asleep. I had a foggy brain. I hurt from head to toe. Life was a challenge. Every day was a challenge for me. And we raised 4 children, and I took care of my mother-in-law. We had a farm at the time with 150 alpacas. We did all the vet work. We bred and birthed them, showed them across the country. We were busy. But life was a blur because I was barely just putting one foot in front of another. And I tried some other alternative modalities, and some of them helped a little bit, but nothing very much until I was introduced to Asea. So I started to drink Asea Redox, and within a couple weeks, I got my energy back. I started sleeping only 8 hours a night, and I felt like getting up in the morning. Also, my foggy brain cleared up. I could get organized. I could think about all these projects I had around the house that I was not able to get done. And then it actually took about 6 months of drinking more Asea. I increased my dose because when I say I hurt from head to toe, that didn't go away right away. And a lot of people have different experiences. That was my experience. It wasn't immediate, but it was over a period of about 6 months that I started feeling much, much better. I felt like a new person, actually. I couldn't remember a time, maybe when I was a little kid and I used to do lots of cartwheels and I had a lot of energy. That all came back to me. But I didn't do
I was
cartwheels.
going to say, I haven't seen you do a cartwheel for a long time.
Yeah, but I felt like I could have. So that's my experience. But we are so honored to have Dr. Dwayne Starr with us tonight. And I'm going to let him tell a little bit about his background and how he got introduced to Asea and what has happened for him personally. And also, we know that he uses it in his dental practice. So first of all, Dr. Starr, Dwayne, tell us about yourself and how you got introduced to Asea.
Well, thank you, Dick, Nancy. Well, my wife and I shared an interest in the same alpaca industry that Dick and Nancy did. And along the way, they they shared Asea with us, and um, we became consumers of Asea. And my wife was fond of saying that she becomes creaky unless she has her Asea. And she knits a lot, so yeah, her hands would be arthritic and much worse if she wasn't using Asea. Um, so it helped. It's given me energy. It's given me a lot of probably a lot of intangible benefits that I'm not even aware of. Um, I liken it to how do you know your kidneys are working all the time? You know, you just don't feel it. But along the way, I became acquainted with Dr. Dr. Osler and his book Redox Matters, and then Healthy Matters. And I consumed those two books and was just really interested and fascinated. Dick and I started talking about other areas where ASEA might help, or why does ASEA help? That's the question. I know Nancy, as a hygienist, observed her patients benefiting from ASEA in her day. And we've become to appreciate ASEA as well in our practice. Um, uh, Early on, we also corroborated that it's good for tissue inflammation. And so people with periodontal disease can benefit from ASEA. And serendipitously, I kind of just discovered that ASEA facilitates the clotting process. And in dentistry, we get to use that clotting process a lot. So,
Mhm.
in various ways. And so it's been an interesting journey.
So
And
maybe before we go on, we probably should remember to give the disclaimer. Go ahead, Dick, because
Yeah,
that we need to give a disclaimer before we talk about some of these things because we're medical professionals, and although you don't need to be a medical professional, we want you to understand. Go ahead
sure.
and
And ASEA doesn't cure, heal, or treat anything. What it does is supplies the body with a tool that it's very familiar with because it's native to the body, that the body can use to orchestrate the repair process, slow down the oxidative stress, which causes or accelerates the inflammatory process. So the body knows exactly what to do with these, but these molecules in and of themselves don't know what to do until the body has them and uses them. I like to describe redox signaling as the language of our cells. It's how our cells communicate. And the molecules in the Asea redox are identical to the molecules that are made in every one of your cells in an organelle called the mitochondria. But Dwayne, the other thing I'd like you to do is to kind of go over your background. You know, where your education and that sort of thing. What led you to become a dentist, and then why, as a dentist, what impressed you so much about ASEA that you sort of went out on a limb and started, and you know, you were impressed with what it did for you personally, but not every medical professional that uses this product personally necessarily takes it into the clinic and uses it in the clinic. So maybe kind of give us your education, your training, and then what was it that you see in ASEA, both from a personal standpoint and from reading Lee's books, and how that process morph into using it in the clinic.
hmm, well, I became interested in dentistry at a young age and was persistent and got through dental school. And at OHSU, I've always been interested in science and um, and dentistry in general. Um, I was fortunate to buy a practice in Southeast Portland, where Dr. Collins was instrumental in pointing me in a couple of right directions. Um, he got me hooked up with a lot of. I should say that Dr. Collins was a pioneer in implant dentistry, And he was, in fact, he was such a pioneer, he was grandfathered into the specialty of oral surgery and took a special interest in implants as well as many other oral surgery procedures. Um, so he pointed me in the direction of the American Academy of Implant Dentistry. They've been my home academy for many, many years. Um, and then I became a diplomat of the American Board of Oral Implantology, and I also an honored fellow with the American Academy of Implant Dentistry. So
So
it's
that's above and beyond just being a general dentist, is that right?
yes, it is. The ABOI is the de facto specialty group for implants, and American Academy of Implant Dentistry has been dedicated for over almost 60 years to the high level education of the profession in implant dentistry.
Right.
So a lot of what I do today is general dentistry, but I also do a fair amount of bone reconstruction and placement and implant supported prosthesis. So um,
So you're at the sort of cutting edge of dentistry. You're not just putting in fillings and doing that sort and crowns and that sort of thing. You're doing that too, but
that's all a part of doing implant dentistry. So that's just another tool. Implants are a tool to help you restore a person back to health and function. And
so being at that and knowing all of that, along comes a new technology called redox signaling. And what was it that made you think beyond just liking the product personally? What made you think? What was it about the oral health and oral ill health that made you think that redox signaling could be of benefit there?
mhm. um, I taught implant dentistry with a group of a dozen docs. We had a common interest in promoting tissue regeneration, and of course, we get into stem cell technology. We get into exosome technology. And so when I understood, and hearkening back to my freshman year of histology and remembering clearly our professor saying, we know cells communicate, we just don't know how. And now we know how.
You
And
know
the
it.
implications of that are very significant. And so you think about that and you're constantly trying to figure out how to make things better for your patients. And there are very small incremental steps, but there's a kind of a road you take, and you come to in this journey as you understand, as you read papers, some of them produced from Asea, some of them just out in the literature that you can find, the activity of these little nucleic factors, and and so it just leads you down a path where you go, aha, we can make our surgery, we can make the patients recover from our surgeries much better. And I think we found some real key steps using Redox to do that.
Yeah, and I just want to bring up everybody listening has probably heard people say and perhaps experienced themselves when they swish, that's what we recommend for a SEA supplement, that you swish it in your mouth for 15 to 30 seconds before you swallow each mouthful. There is a purpose we do that. There is a reason we do that. And we've heard people say, "Oh, I went to the dentist and my hygienist said my gums look so good. And I used to have, a pocket or a problem, and now it's gone." And we know why that is now. Like you say, we know what's happening when we swish with Asea Redox and how we can maintain our oral health because of several things. First of all, we're managing oxidative stress. When you have gum disease, and that was my specialty, I worked on people who had periodontal disease, gum disease. Believe it or not, I loved it. And doing that because I knew I was doing something good for people. But there's a lot of oxidative stress in the mouth, just like in the body when you're not feeling good, when you're imbalanced with these molecules. Well, when you swish in your mouth, you're going to manage the oxidative stress. You're going to increase your defenses against those bad bacteria because the Asea redox can kill some of those bad bacteria without harming the good bacteria. And also, and you mentioned it, Dr. Dwayne, promoting tissue repair. Because when you don't have a healthy mouth, there's a lot of damage to the tissue, damage to the DNA, gum damage, and it goes even beyond that, which we'll talk about, systemic problems that happen when you have disease in your mouth. And so that's why you should be very concerned about keeping your mouth healthy, keeping your oral health at its optimal level. And we can do that with Asea Redox. So do you
we know that the natural redox signaling molecules made in our body are very important in oral health and in maintaining oral health. I would imagine you see a lot of people with really bad oral health. And, Nancy mentioned oxidative stress. So, you're dealing with people that have issues with oxidative stress in their mouth all the time. And I would imagine that really makes it difficult for some patients to improve their oral health. So what have you seen? Let's say you send a patient home with a couple of pouches of Asea. What have you seen just in general, without getting technical? What kind of an influence does that have on their mouth, on their oral health?
Well, after we get them over the taste and get them to be consistent with this, um, we're observing a shift in the inflammation in the gums. You can see the redness, you can bleeding on probing, different things you can do to measure those objectively kind of things. And less pain, less inflammation. So it's a paradigm shift. People are like, why do I want to take this stuff? And we convince them to do that and often say the worse it tastes, the more you need it. I'm not sure if that's true or not, but it seems to follow. And so, yeah, people are uh, people are on drugs that have give them challenges to their healing, and the ASEA can help overcome some of those issues,
Right.
particularly the ones that impact our systems that stop bleeding. That seems to be one of the biggest areas that I've observed. So getting control of inflammation and it's a dual prong approach. You're trying to get them to control their plaque levels, their biofilms, but then what's left, the ASEA will help them overcome that.
And so that's why we recommend swishing with
That's
it,
right.
because research shows that it will target the harmful bacteria in the mouth while protecting the beneficial bacteria in your mouth. You have both kinds, but you have a lot of bacteria, right, Dick? Dick has seen human bites in the emergency room. You know how bad those are, right?
The mouth is just loaded with bacteria.
Loaded.
And, some of those bacteria are beneficial, some are not. But it does appear that redox signaling molecules are important in nurturing the healthy, beneficial ones, as opposed to the bad actors. But it seems real clear that the redox signaling and correct redox signaling is really important for maintaining proper oral health, beneficial oral health. We're starting to hear a lot about the oral systemic health connection.
Yeah.
And that seems to be a very, very important issue in general health. Would you care to comment on that at all, Dwayne, Dr. Starr?
Absolutely. So I guess serendipitously, I just produced an ad for just public health
Education.
awareness
Yeah.
that uncontrolled plaque can cause any of these: tooth decay, respiratory infections, periodontal disease, which is bone loss around the teeth, heart disease, stroke, preterm and low birth weight babies, colorectal cancer, dementia slash Alzheimer's,
Mm-hmm.
bleeding gums, type 2 diabetes,
Mm-hmm.
and there's other ones, but that's a good list to start with.
So
Yeah.
those are all the consequences of poor oral health, right?
Yes.
Yes.
You know, oral systemic starts at the mouth. Of
Mm-hmm.
course, it goes all the way through to the other end as well. But it appears, and if we were talking about this 10 years ago, do you think anybody would know what we were talking about? They'd look at you like, what do you
Yeah,
mean?
it's just my mouth. But that people don't realize it's the opening to your body, your whole body. So when you have oxidative stress in your mouth, like you're saying, it leaves you susceptible to systemic disease, not to mention oral cancer, liver disease, all those things. Cardiovascular disease is a big one with
Yes, it is.
gum disease. And so and we're not saying that Asea cures any of those diseases. We're saying if you don't have good oral health, it leaves you susceptible to being sick.
Right. And we're not saying that
Well, you know,
we're not saying
systemically.
we're not saying that supplementing with the SIA necessarily prevents all of that.
No.
What we're saying really is that paying attention to your oral health is more than just not getting cavities. It's more than not having bad breath. It's more than somebody saying, "Man, you got problems with bleeding gums or whatever." We're talking about the fact that having good, superior, better oral health is way more important than just what's going on in your mouth. It influences your brain health, your heart health. Everything is can have adverse consequences from poor oral health. And you don't have to necessarily go to a dentist to improve your oral health. You just have to do some simple things that control the oxidative stress that leads to a increase in that inflammatory process in your mouth. And it just so happens that we found that ASEA can be very beneficial in that way.
Well, I want to remind everybody, and those of us who have been associated with ASEA for a while, remember that redox signaling molecules boosts your endogenous antioxidants that are made in your cells. That means not from outside your body, but the ones made in your body. Increase your glutathione by 500% and your superoxide dismutase, which is made inside your body, also boost that 800%. Now that's what's going to help you repair your tissue in your mouth that happens if you don't have top-notch oral health. So that's why it's so important to swish when you're drinking your Asea Redox. You swish for 15 to 30 seconds each mouthful. So research shows that really makes a difference. And that's why they recommended, Asea recommends that's how you take this supplement. So we're talking about healing, we're talking about balancing the oxidative stress, and there's another way. Do you want to talk about the NRF2 pathway? That comes into play also, and we've heard about that in we've seen the white paper on NRF2 genetic pathway that is accessed through Asea Redox.
Yeah, well, NRF2 is a transcription factor that controls the activation of certain genes that are crucial in the body's ability to make antioxidants like glutathione. And ASEA has done a study that proved that by improving and increasing the activation of NRF2, that has a tremendously beneficial effect on the production of antioxidants, in particular glutathione, which is sort of the master protector of your cells because of the beneficial effect it has on counteracting oxidative stress, which, if left unchecked, can have a negative effect on the inflammatory pathways, which wreak havoc throughout the body, and in fact can lead to accelerated aging. So by having the effect of boosting your glutathione levels, that is a good thing for your body in a number of different ways. And Asea does have that study that shows indeed that redox signaling molecules have that benefit. So that's a very good thing overall, not just for the effects in your mouth. And like Nancy said, to get the beneficial effects on your oral health, you have to hold it in your mouth for 15 to 30 seconds or so. You just can't gulp it down in a couple of big swallows. Even if you don't like the taste, you should hold it in your mouth and let it do the good things that it does while it's sitting in there, having the effect on the bacteria in the mouth and having a beneficial effect on the tissues in your mouth, not just your teeth. The effect on your teeth is sort of an indirect effect of improving the overall oral health environment.
So we've talked about the reduction of bacteria that can happen even in the pockets because it's liquid and it can go down into the pockets, the periodontal pockets. But we've also heard you say, Dr. Starr, that you do all these procedures and you always have a better outcome when you put Asea in the mouth during that procedure. And what do you think is the cause of that? Just a reduction in bacteria, getting rid of oxidative stress, or in the mouth? I mean, every dentist, I think, should use this. Every dentist that's doing procedures, not just on the gum health, but tooth health as well, and the sensitivity, of the teeth, I think, is affected.
Yes, I go back to the basic pathophysiology of how things work. And these signaling molecules seem to, as an old Texas term, it greased the skids. It facilitated the reaction that was going to happen anyway or needed to happen. But these signaling molecules are facilitating this in some way. And I would love to be at that level to be able to see it or something, some way to, but I believe the cascade of clotting, there's two pathways, and I'm sure it's facilitating the one, especially when there's drugs involved that knock out one pathway and you're relying solely on the other one. That's where ASEA is facilitating clinically. I'm seeing a difference, a major difference.
Mm-hmm.
And
Mm-hmm.
so that's where I start is clinically, and then I'm trying to
Mm-hmm.
substantiate with papers, and it's nice to see has helped us with that.
Mm-hmm.
So, it goes without saying, it sounds like you've seen a number of your patients who have benefited in a number of different ways by the fact that you're using Asea Redox in the clinic and sending people home with it quite often.
Mm-hmm.
Great.
Mm-hmm.
Well, did you have anything else you wanted to cover, Nancy? Or?
Well, I think, the mouth, we're talking about oral health tonight, but really, there's, it's a different environment from the inside of your body, but it's the same thing. We know that when we're not, let's see, what was what was my train of thought there? I can't remember what I was going to say. When we're not healthy, what I was going to say is as we get older, often people think they just accept the fact that, well, I'm older now and things, I have this and this and this doesn't work as much and it's because I'm older and they just accept it. But getting older doesn't make you sick. It's having a deficiency and an imbalance of redox signaling molecules that could leave you susceptible to getting sick. And the same thing is true in the mouth. And so Asea is the one and only company in the world who has produced redox signaling molecules technology stable enough to be put in a bottle and shipped around the world. And so we are so lucky to have this, because as time goes on, you just have to take the responsibility of being well on yourself. You can't depend on your doctor. You can't depend on other people to keep you healthy. It's a lifestyle. Asea Redox is part of our healthy lifestyle. And people who drink Asea Redox, by and large, I want to have more energy. I want to be well and enjoy my grandchildren and enjoy my life in this part of my life. So we are so very, very fortunate to have this product. Thank you to Virtus Norton, who was the founder of this company. And it's a 100% safe, non-toxic product that we can drink every single day. And we have a gel that you put on the outside of your body, so you're healing from the inside out and the outside in. It's helping your body heal itself, rather. So you can be well and enjoy this life. So
one of our associates just pointed out we may have stated the percentages on that glutathione and superoxide dismutase opposite. It's 800% increase in glutathione and 500 in superoxide dismutase. And that's important, but the fact that it does
that's a pretty big numbers.
That's a pretty big numbers, whatever way you look at it.
Yeah.
But Asea is just a wonderful product that's duplicating something that's native to the body. And the fact that, it is by far the safest recommendation that I ever make to people about something that can improve their health. And when I was back in practice and writing prescriptions, sometimes I spent more time talking to people about the potential side effects than I did about the reasons why I was writing that prescription. And so, and I know the pharmacist. Yeah. So this is just a wonderful, safe product that can give the body a tool that can do some wonderful things with it in terms of enhancing the body's own ability to repair and replace damaged cells. And you get to appreciate the benefits of that process when you supplement with this throughout the body, not just in the mouth and not just in the gut, but throughout the body. So
we have some people commenting on how their oral health has improved so much. There's somebody that has a question: how does it increase your energy? What would you say? Well, for one thing, for me, how it increased my energy is it helped me sleep deeper. And often you'll hear people say that I started drinking Asea Redox, I sleep like a baby, because you have to get into the deeper levels of sleep and go through all the sleep cycles in order to sleep is like a detox for your brain. And you have to go through all the sleep cycles in order to get rested and to have your brain let go of stress, and then you have more energy. That's how I know. I don't know how it does that, but it helps everything get better. It helps normalize. It helps your body behave like it should.
Well, yeah, I think it's multifactorial. I mean, certainly being able to sleep better, but if you can give your body a tool that it can use to repair a multitude of things, you're going to quit worrying about the problems that you had. You're just going to feel better overall. And having more energy is sort of a nebulous term. I think what we're describing is that people just feel a lot better. They feel like doing things. They feel like living life and interacting. And that's a kind of a nondescript way of saying, I really feel better when I take this supplement. And we get that feedback a lot.
So as we get old, the mitochondria in the cells are the little energy, but that's a different kind of energy when you're talking about the energy that runs every major organ system in our bodies, but maybe that helps us feel energetic as well. Because as we get older, we don't have as many mitochondria producing these molecules. That's why we supplement with Asea, the big blue bottle, Asea Redox.
Is there anything else in the chat we need to address, or are we doing good there?
Let's see. Yeah,
Yes.
every process in the body requires energy for sure.
Yep.
And Asea Redox helps to manage every major organ system in the body from head to toe. It
Well,
even crosses the blood-brain barrier.
You can't live without
No.
redox signaling molecules, and the ones in the sea are identical to the ones that your body makes. And so it just facilitates all of those things that our native redox molecules do so well, and gives your body access to some more signaling molecules, improves the cellular communication a large amount. You know, the signaling molecules that are made in your body are only active for a few fleeting seconds at the most. The ones in Asea stick around longer to get the job done. And so this is just a wonderful technology that is helping, millions of people around the world.
So I think, I think Dr. Starr, you might agree with us. We would never go anywhere without our Asea Redox. Right now, we're visiting our daughters, and we packed our suitcase this morning, and the very first thing we packed was our Asea Redox. We get the pouches when we travel, but that is the first thing that goes in our suitcase, because why would we ever go anywhere without it? We want to feel good when we leave the house. And so we have our Asea products, and I know that you've traveled to Texas and to see your daughter in different places. And it's just part of our lifestyle, right? I
It
will
is.
never stop drinking Asea Redox.
Dwayne, did you have anything else you wanted to add?
Well, I think so. In terms of oral health, we've known for many years that to avoid that nasty list of things I just read off, removing plaque every 24 hours will do that. And sadly, that doesn't get done in a large portion of our population. It will, just doing that will avoid many, many things. But using Asea really is taking your oral health to the next level, because not only are you just avoiding the biofilms that are eliciting these dangerous inflammatory reactions that we see so often in the mouth, but by removing the plaque as well as conditioning the tissue with redox, you're getting your cells to a level of health to then be more resistant to these occasional attacks that come along. I recently had the occasion to re-cement an implant crown from some kind of a little rock that was in his lentils. And so when I took that crown off and I cleaned the crown up to put it on, I couldn't believe the tissue. Now, he's a flosser, but he's also a daily Asea user. Just, 2 ounce in the morning, 2 ounces in the evening. I took pictures of this because the pink was so healthy, no indication of bleeding, nothing. And this is where you have to live if you're going to have implants, because there's no physical barriers between the outside environment and the bone. Just very little soft tissue resistance.
So we have one more question, and I want to pose it to you, Dr. Starr. People are always wondering how to approach their medical professionals, their doctors, their dentists about Asea. And I want to ask you a question. If we had come to you and said, okay, we have this product and we think you ought to get some for your dental practice, would you have been as open to that instead of us coming to you and saying, hey, why don't you try it, you and Val, on the creaky knees, the other things? I think I'm going to let you answer that, but what approach would be more successful? Approaching a medical professional about their practice, or for their own use?
I think I think their own use first. They have to understand what they have to understand ASEA at an experiential level, and that's probably going to be with the topicals more than the liquid. But if they take the time, the due diligence to really study this science and to understand what's going on here, I think they'll be open. I think they'll understand how it can be beneficial in their
And now we
practice.
have Redox, sorry to interrupt, but we have Redox Gold. And
Yes,
you can that's a topical gel for discomfort. You can put that on somebody and they can notice within minutes a difference. I mean, that is really how to get someone's attention.
absolutely. And if they've been in practice very long, they're going to have owies. And that is probably one of the fastest ways to demonstrate the power of redox is with Redox Gold.
Not in
I
the
literally
mouth,
have had a pain in my neck in the last few weeks, and it's really helped with that.
I was just going to say that.
Nancy
You
said,
and I have problems. Anybody working in the dental profession has a problem with their neck. And usually it's one side of your neck because you're sitting on the side of a dental chair. Yep, it's the left side.
Yeah,
And I tell you, with my own, I'll give you a little testimony. The left side of my neck feels like a steel bar most of the time, and I can't really turn in that direction as well as I can the other way.
yeah,
So I use the Redox Gold, and it softens up immediately, and it gives me more range of motion. It's
yeah.
really incredible. If you haven't tried the Redox Gold, that's where it's at. Um, so,
absolutely.
yeah. And Dick, your back problem, you want to just give a little testimony for Redox Gold?
Yeah, if it weren't for Redox Gold, I might not be sitting here today because my back flared up a couple of days ago, and I've had chronic issues with back discomfort for years, and I just as soon as this Redox Gold came out, I was really pleased. It doesn't take it all away, but it definitely makes it more manageable, so I can still do things. It's I
Hmm.
love it, absolutely. Well,
And
I think we've
yeah,
kind of could probably wrap things up and.
yeah. So just to reiterate, dentistry is hard on your body.
Yeah.
Introduce Redox Gold to your dentist no
First,
later than tomorrow.
No, thank you.
and let them decide what they want to do with it beyond personal use. But
Yeah.
definitely, make a believer out of them first, and then let them decide if they want to share it above and beyond that. But it clearly using the redox supplement, swishing, swallowing can definitely have some beneficial effects on oral hygiene and oral health.
Yeah. So we want to thank everyone from around the world. Thank you for spending this time with us. And we sure appreciate you joining us. We wish that we could talk to each and every one of you individually, but we sure appreciate having this opportunity.
Thanks a lot.
But
Just push.
yeah,
And I just want to say, if any of y'all's docs want to talk to me about this, I'm sure Dick and Nancy can get your contact information to me or to you for me.
yes, that's great. Just contact us and we'll connect you to Dr. Starr because he's got the most experience clinically in his dental office of anyone that I know, other than Lee Osler, probably, the two of you
Mhm.
guys. So thanks, everybody. Appreciate you hanging in here for the whole time. Good
Good
night
night.
now.
Have a wonderful holiday weekend.
That's right. Be safe.
That's right.